Diseases of the thyroid gland in dogs and cats. TRH, which is thyrotropin releasing hormone, reaches the thyrotropic cells of the anterior pituitary by the blood vessels. And it enhances TSH, which is thyroid stimulating hormone. In canine hypothyroidism, there's primary hypothyroidism and secondary hypothyroidism. In primary hypothyroidism, T4 decreases and thyroid stimulating hormone increases. In secondary hypothyroidism, T4 also decreases, but thyroid stimulating hormone decreases as well. In the signalment, it affects young, middle-aged dogs, especially large breeds. For the pathogenesis of the disease, it's an autoimmune disease, which can cause a lymphocytic thyroiditis. The clinical signs are lethargy, obesity, hypothermia, alopecia, reproduction problems, megaesophagus, and thickening of the skin. For the diagnosis, you need to test the blood. You can see a normocytic anemia, decrease of T4, increase of thyroid stimulating hormone, and an increase of T4 antibodies. This reflects the autoimmune disease. The treatment is levothyroxine. Hypothyroidism in young animals. It can be congenital or acquired. If it's congenital, it's usually a failure for the gland to develop, or it can be an enzyme deficiency. If it's acquired, it's usually iodine deficiency. Discuss the clinical signs, and for the diagnosis, you need to see thyrotropin releasing hormone and thyroid stimulating hormone. And for the treatment, you need to supplement T4 and iodine. In hypothyroidism in cats, it affects middle-aged to old cats. T4 increases and thyroid stimulating hormone decreases. The clinical signs are polyphagic and weight loss, and goiter, which can lead to dyspnea and dysphagia and coughing. For the diagnosis, we can see an increase in hematocrit, increase in white blood cells, and azotemia, and it's usually linked to a kidney problem. For the treatment, if there's a post-operative hypocalcemia, you need to give levothyroxine. And you can also give methimazole, but it doesn't stop the disease and it has side effects. For thyroid tumours in dogs, it usually affects old boxers and beagles. 85% of cases are malignant, and around 20% of cases result in hyperthyroidism. The clinical signs are goiter, such as dysphagia and coughing. The diagnosis is an X-ray. Never do a biopsy when you're doing a surgery. And the treatment is a thyroidectomy. The regulation of thyroid function happens at the hypothalamus-pituitary-thyroid axis. TRH, thyrotropin releasing hormone, reaches the thyrotropic cells of the anterior pituitary through the blood vessels, which enhances thyroid stimulating hormone secretion. Thyroid hormones reduce the number of TRH, thyrotropin releasing hormones receptors on the thyrotropic cells. In canine hyperthyroidism, there's primary hyperthyroidism where you've decreased T4 and increased TSH. In secondary hyperthyroidism, you have both decreased TSH and T4. For the signalment, it's a common endocrinopathy. It's common in young and middle-aged dogs, and it's common in large breeds such as retrievers, Doberman, boxers, Irish setters. In felines, spontaneous hypothyroidism is very rare, but hyperthyroidism is a common feline disease. So the pathogenesis of hypothyroidism, it's an autoimmune disease. There is an autoimmune inflation of the thyroid tissue. We can see lymphocytic thyroiditis. In the histopathology, for lymphocytic thyroiditis, we can see lymphocytic and mononuclear infiltration. The function of the thyroid is to maintain the speed of metabolism, and a dysfunction can affect almost every organ system. For the clinical manifestations of a dysfunctioning thyroid, we can see lethargy, disinterest in exercise, weight gain, cold intolerance, skin thickening, also known as myxedema, hyperpigmentation, alopecia, bradycardia, and reproductive problems. For the diagnosis, we need to look at the blood. We can see normocytic nomochromic anemia and lipemia and severely elevated cholesterol. T4 and THS should be measured simultaneously. T4 will be decreased and TSH will be increased. We can also measure T4AA, thyroxine autoantibodies. If these are elevated, it reflects an autoimmune effect on the thyroid tissue. For the treatment, we can give levothyroxine orally. For hypothyroidism in young animals, it can be congenital or acquired. In congenital, it's usually from thyroid dysgenesis, so a failure for it to develop in a normal location, or enzyme deficiency, so there's decreased hormone synthesis. If it's acquired, it's from iodine deficiency. For the clinical manifestations, in neonates we can see myxedema, goiter, and hypothermia. And later on we can see disproportionate dwarfism, goiter, and a large tongue, and lethargy. For the treatment we can give T4 supplementation and iodine. For the prognosis, they can have permanent skeletal deformities. Hyperthyroidism in cats. For the signalment, it's most common encountered endocrinopathy in cats, followed by diabetes mellitus. It's found in middle-aged to older age cats, so around 8 to 14 years old. For the pathogenesis, it can be idiopathic hyperplasia or caused by adenoma. For the clinical manifestations, we can see polyphagia and weight loss. The owner might think they have a good appetite, but their health is actually not good. We can also see restlessness, and this is a part of the sympathetic hypertonicity, so they're hyperactive. And we can see goiter, which can cause dyspnea, dysphagia, and coughing. And it can cause diarrhea and vomiting. And the cats can get sudden blindness due to hypertension, and they have their tongue sticking out. In the diagnosis, we can see increased hematocrit and leukocytosis and neutrophilia. There can also be azotemia, so pay attention to the kidneys as they can often have chronic kidney disease. And we can also see increased T4. For the treatment, you can do a thyroidectomy. Hypocalcemia can develop as a complication if it's bilateral. And as a result, hypoparathyroidism develops post-operation. And make sure to give a low iodine diet, as T4 then decreases, which makes blood pressure decrease, which makes a GFR decrease, which decreases azotemia. For thyroid tumors in dogs, the signalment, it's only if it's found in old boxers, beagles, and retrievers. It's malignant 85% of the time, and it's most often unilateral. And in 20% of the time, it's hormone producing. So 1/5 of the dogs with carcinoma can have hyperthyroidism. In the clinical signs, we can see goiter, which leads to dysphagia and dyspnea and coughing. And for the diagnosis, we can see it on the thoracic X-ray, and we can see increased T4. For the treatment, a thyroidectomy is urgent. In thyroidectomies, they're done in the case of canine thyroid tumors when there's a carcinoma. In feline, there's no real indication for surgery. For the surgeries, there are two main types, extracapsular and intracapsular. Extracapsular is always done because it's better.